Now let's start them and give them insights about AMC and OET.
Okay, so let me introduce myself. My name is Dr. Nabira. I just completed my house job in 2023 from Pakistan, and then I just gave my exam within 4 to 5 months in November 2023, just clear my AMC MCQ exam in December. After that, I joined my residency program in my own country in psychiatry after being so much impressed from the AMC. As you know, it's very well scoped in other countries as well. So today I'll tell you about the perks of AMC and why you have to choose AMC instead of FLAB and Emily. Every exam has their own benefits, but AMC is giving the boom nowadays. So first, I want to tell you guys about the pathways and how its pathways are different for the fresh one and from the GP pathways and for the specialist, and how to become the doctor in Australia, right? So these are the just luxurious things for the people that you have beautiful beaches, greenery. The main thing is you have to maintain a work balance between your life and your workplace, right? So Australia is a perfect place. Like it have less work times, but more time with the families and whatever you want to do. Salaries are basically more. After US, Australia for doctors is the second most highest paid country. Career advancements, more opportunities, like they will not limit you for only the freshie one, for the GP one, or for any people who have just passed 25 years in their own country and now they can apply as well, because there is no age limit in AMC. That's the great benefit, I guess. Okay, so first I want to know you guys that how much you know about AMC. Like what's the course outline and how you can prepare? Anyone? Any wild guess? Participants can also write, also can speak if you want. Okay, let me start myself about telling about the AMC. So AMC is a very basic exam. Like it's like all final year subjects, all about the final year subjects you have doing like the gynae, surgery, medicine, pediatrics, psychiatry, community medicine, ENTI. It's all about this. No basic subjects that you almost forget like in first year, second year, or third year, right? So it's no basic sciences, just for the clinical BCQs, the way they ask in scenarios, not for the simple like that. They only give the options, but they will give the live examples, how you receive the patient in ER, how you receive the patients in GP practice, what are the office tests, and what are the basic tests you will do in ER. So they will give you everything in the scenario type, right? Okay, the most benefit you will get is you can apply for the job even after just passing AMC 1. This is I'm talking about for the one who have the experiences of 5 to 7 years or 3 to 4 years, more than 2 years. Even freshies can apply as well, but for freshies they have to experience like 1 to 2 year of resident medical officer in their home country or in anywhere, excluding house job. That is called internship of 12 months. Secondly, as long as you are moving with the pathways after passing the part 1, for either you go for work-based assessment or you go for AMC2, there's also a residential program going on, like for your PR program, that's we call. The one and most very good thing about the system is it's an AI exam, and also this is the most difficult task as well, because a lot of people don't know about the AI exam. Yes, sir, you can absolutely get a job after passing AMC 1. What I told is, if you are a fresh graduate, you have just for 1 to 2 years of experience as a resident medical officer in your home country. And if you have an experience of 3 to 5 years, and after that you are giving any type of exam like AMC or anyone, you will get a job from your home country. You just need to apply. That's it. Okay, the next thing is what I am telling about is very important. Make sure it is an AI exam. A lot of people don't know about the AI exam. Basically, AI exam is like whatever the answer you have given previously will depend on the next question. For example, they give you a question of related hernia in this is the first question, okay? So the second question will be depend on how you will do it. You will do it right or wrong. If you do it the right, they will give you the harder one, and that harder one have more marks. And if you do it the wrong, they will give you the less competitive one, so they will have the less mark.
Ma'am, can
Okay,
we skip a
Asma.
question?
Sorry.
Can we skip a question?
Yeah, sure. You can ask.
You said the difficulty level of the next question depends on previous one. So if we don't know the answer, can we skip that simply?
No. The one thing about this exam is you cannot go back. You cannot skip the question. Once you have done the question, like for example, you can change the option like from A, B, C, D. But after choosing that question, you have to skip the next. And after the next, the question will not appear again, and you will not skip the question.
Okay, thank you.
Okay, the cost in exam is you have to convert the dollar rate. Basically, it is 3,000 AUD. It depend on the dollar rate if you convert into PKR. Mostly it's like 7 to 6 lakh across. No, you cannot sit in the exam before doing house job because it's require your own country's registration. Like in Pakistan, we follow the rule that after getting our 12 months of internship, we get there's registration number that is called from PMDC number. So it will require for your EPIC verification and for your AMC portal. When you made the AMC portfolio, they will require that number as well. So your degree and your license from your own country is required. You cannot skip it like in MLE, like you skip your house job, you cannot do it. Okay, the other thing I want to tell you about it is the scaling system. It's not about the scoring, it's about the scaling system. Yeah, I will tell the later about the course and everything. So the scaling system is like you can score from 0 to 500, but the basic you have to pass is 250. If you get the 249, you will be fail. If even you get 249.5, you will fail. So scaling system is like a different system, and you will never count even like you get a one score from this question, score from this question, because you will get 150 questions. You never know which question carry the more mark and which question carry the less mark. So scoring depend on the level of difficulty the AMC will give you. As I told you, it's an AI exam. The more you correct, the more you are getting the marks. For example, one of your colleagues will pass on doing 100 MCQs, but you will pass on doing 90 MCQs. You have to attend all questions, like 150 all you have to attempt, but some will pass on the 90 MCQs, some will pass on the 120 MCQs because difficulty level are different and scoring system are very different. So some people are asking about the course outline and the subjects. So this is the distribution. Adult health medicine include emergency medicine, and it is very important. It's 30%. Like surgery is 20%. In surgery, all of the subjects are included, like urology, orthopedics, anesthesia. Every subject will be included. Same goes for medicine, like nephrology, psychiatry. Even psychiatry have that different portion, and it counts a lot. In AMC, you will find three things very difficult, and mostly the pass and fail decision will based on them. First is psychiatry, the second is gynecology, the third is ethics and community medicine, because these subjects are very different. Yes, you will get the material. Once the webinar is done, you will ask and contact with Asma. Asma will give you every detail. Okay, the obs and gyns is 12.5%, but it's very important because it's all depend on the basic guidelines. Pediatric is 12.5 as well, but in pediatrics, they will ask you more about from the guidelines as well. Mental health include psychiatry. It also include community health as well, population health, and geriatric population as well. So be sure that every type of component will be covered regarding with clinical. One more thing I want to tell that pharma will be covered in a sense of medicine and surgery. No, I just said that you can take your AMC exam just after completing your house job or internship. Like I did my self. I just did my AMC exam just after 4 months of my house job. But when I apply for the jobs, they will literally restrict me like you have at least from 1 to 2 years of minimum experience in your own country. Getting my point? You can straight away appear in the paper after just getting house job, but for the experiences you have for 1 to 2 years for the fresh graduate, not for everyone. So some of
Hi,
you
Dr. Nabira. Hi, can you please rotate your screen because we can see a small screen. You just have to rotate your device.
okay. Now it's look good.
Yes, it's fine, ma'am. Thank you so much.
No worries. Okay, for the preparation, so these are some final year books that you have to do if you have a weak your basic concept. Because doing these all books will take a lot of time instead of getting a course, and they will outline you more in a better way. So these are the books for adult emergency medicine, on-call medicine, pediatrics, surgery, and gynae. These are textbook. Remember, if you have a short time or you want to pass immediately, you cannot do these whole book wholly. These are book for the reference guide, right? Okay, so among them, the most important book is AMC Handbook and the John Murtagh. These two books are very, very important for your preparation. For example, if there is any topic regarding like surgery or regarding gynae, you have to just open it for the whole topic, but it's written in that. For MCQ book, you have to solve it to take the idea how the MCQs will come in exam, how pattern they are following, right? Other books are for the purpose of just seeing the guidelines and seeing the ethics, how ethics will come. No, it's not nurse. It's basically all books are for the study purpose, right? So we cannot label it. It's for nurse or it's for doctor. It's for basically MCQ exam preparation books. Yes, now you are getting my point. You can just appear after completing your house job, like after 1 to 2 months, as soon as you get your registration from your own country, you can apply for the exam date and then you appear in the exam. But for the job, you can apply. If you get lucky, you can get the job. But for me, whatever the objection I get is like you have minimum 2 years of experience in your own country. So I just started my residency in psychiatry in my own country.
Ma'am, can I ask something?
Yeah, sure.
Ma'am, once we have failed our AMC part 1, but we do not have any experience. So in that case, we have to work in our own country for 2 years with AMC part, AMC 1 having passed our exam.
Yeah, it's like if you pass your exam, just like for example, you have done your final year and you completed your 1 year of internship of 12 months, and after the 4 to 5 months, you appear in your AMC exam, right? After appearing in your exam, you pass your exam like in December. So you started working in your own country from January. Till January to next January, there will be a 12 months of experience. Now you can apply for jobs. Even after passing AMC, you can apply for jobs as well. If you are lucky enough, you will get the job. But in my case, I just apply as far as I just passed my exam, but they put me in an objection that you have a minimum experience in your own country. So you have to apply for like 1 to 2 years for your own country for as a resident medical officer, and then you can apply for it. I hope you can understand my point. Okay. So along with the books, the basic thing which I guess most of the people don't know about it is exam preparation for guidelines. Australian system will run only on guidelines. Like they will not follow the books that will be publishing in 2017 or 18. They are following recent guidelines. RSCGP is among the one of the most best guideline. You will find everything on that thing. For gynae, Renskog is the best thing. RSCGP is the one, and also the Red Book. Red Book, you will find every guideline regarding pediatric vaccination, geriatric population, how to apply the pap smear rules, and everything. Okay, yes, I am coming step by step. I will tell in detail about the recalls and everything. So the most amazing thing about this AMC exam is about the centers. Even there are new centers which are formed newly in Malaysia. So most of the people are giving from Malaysia will not go to Thailand, Bangkok, anywhere. They can give in their home country. In Pakistan, first they said that it will open from February, but I don't know why it's not open. But it will be expected it will open in upcoming months. Okay, Bangkok is the best center. Singapore, Myanmar, Hong Kong, China, Turkey, and in India, it's a lot of more than 15 or 20 plus centers over there. Some countries are missing, but most of the countries have the AMC center as well. So it is easy accessibility. You don't have to go for Australia, do internship, and then will sit in the exam. So it's the plus point, I guess. Okay, this is the thing what I was telling about the fresh graduate. You have a compulsory 12 months of house job. Also, one thing I want to tell about people is nowadays people are splitting their house job in such a way that they have 3 months of anesthesia, for example, but they do 1.5 months of anesthesia and 1.5 months of orthopedics. This is very, very wrong. You will not get an LOR for this. This is very wrong because every country require 12 to at least 18 weeks of rotation in one department. Like you have for 3 months for one department. You cannot split your ward and take another rotation. For example, if you are doing general surgery, you have to do at least for 3 months. If you are doing anesthesia, urology, plastic surgery, orthopedics, you have to do for 3 months. Don't split, please. This will make problem in when you apply for the jobs, right? No, this is the most beneficial point. I will tell later about this. Okay, another thing is what I was telling about registration from their own country. Likewise, I said that after 12 months of 12 months of house job, you will get the registration code. That is called, it is like PMDC, what they are called in India is something different. After getting this, you will make a portal. You will go for Epic verification. From Epic verification, you will make an AMC portfolio, which is like $610, I guess. And then you will apply for the seats. First, they will ask you for the payment and the seats will open for you. Okay, the another is AMC is not for the fresh graduate, it's for the GP pathways, for the specialist one, and for the people who have already done 30 years of services in their own country. There is no age limit. AMC will never expire. AMC count number will never even count in the job. Like no one will ask you how many attempts you will give in AMC, how why you give it so late. There is no age limit. Also, there is no effect on your job for about the count. Like if someone is passing exam in one attempt and other one is passing exam in third or fourth attempt, it's completely fine. No one gonna ask you this question. Even no one will ask you about the max. If you pass on 250, you are pass. If you get 230, you will fail. But if you get 250 and other get 291, you both are pass. No one will consider how much max you will get. So there is no competition in score. There is no scoring system just for pass. No, it doesn't affect. It doesn't affect even it is strong your CV. In a sense, like if you pass your exam from today days and you will apply for after 3 to 4 years, you have a good clinical experience, right? So that clinical experience will help you. Whatever they will just do some fussy thing is on only on the thing if you have a gap. Like they will ask you why you have a gap, why you don't practice. You have to justify it. Like if you clear your exam today and then you will not work a whole pretty damn year, and after 1 to 2 years you will start working in your country, so they will ask you why you don't work over there. So you have to justify in your CV that if you don't work, there's some program which contains CPT points, so you have to do it, right? Like they don't want just CV gap. You have to work every month on your country. Okay. So the most important thing in my journey, which I really regret, if I get that med expert option at that my time, I will surely join it. So you guys are lucky that they are giving you a chance to join this course. In my time, they are not performing this. And now you guys are very lucky they are giving you a course guideline. For AMC preparation, you cannot even eat whole day all the books, right? So you have to buy the courses, which will give you all the outlines, all the summarized texts, all the summarized PDF form work, every BCQs form part sheet, also the recalls as well. MedExpert are giving literally amazing offers and then amazing videos, live sessions, everything what a student would wants to pass. So it will easier for you guys that you will get the whole thing in a one plate. So these are the crash courses just for 2 months courses that's starting from the 10th of June.
Yes, Dr. Nabira, just to tell the audience that in Recall Crash Course, we will be conducting live sessions in which Dr. Nabira will be your mentor. We will be having 3 other mentors with you that will be in your AMC guidance journey. We are going to provide you the recording of every live session. Apart from the live sessions, we are going to provide you the Q bank that will contain 5,000 plus questions with explanation as well, so that all the concepts that the mentor are going to deliver you will be polished. And apart from QBank, we will be having quizzes, mini mocks, mock exams that will be just exactly like your real AMC exam, so that you will be well prepared before your actual exam.
Okay, the one thing I want to tell you about that, MCQ bank exams are very important, which MedExpert are literally providing. It is very important for your practice because the day you cannot sit like whole day you are reading and then just sit in the exam. You have to prepare for the banks, and they are providing 5,000 plus questions that are sufficient enough. Without even doing these bank, you will be clueless in the exam. Trust me, because it's an AA exam. You have to make your reflexes of solving BCQs every day. Like even in 5,000 exam, you have to divide. Like I have to do 200 in a day. I have to do 130 in a day. So that will make you reflexes. And on the exam day, you will literally going through very easily. So these crash courses and the main courses are very important for your exam preparations. Also the files. What I told you that you cannot eat a whole book. You cannot do emergency medicines 2000s whole page book. So they are just summarizing the main points. They are adding up the guidelines, new guidelines, and they will just giving you in the form of PCQs. So you will not have to do much more things. Just you have to take the course, just follow the course religiously, and you will, trust me, get through this hard time. Okay, the next thing is about the regular course. This is, I guess, very important for any person who is starting from scratch, like anyone who just completed their house job, any GP who just having he is not maybe in touch with the studies. So for the GPs and for the freshies, regular course are best for you. It's been like 3.5 months of course. All live session will be giving, all recordings will be giving. Even in the end, I and other mentors will help you guys in the exam weeks to just solve the questions. You can ask us personally as well if you are skip or you get stuck in any question. We will always there for you guys. Yes, for OAT, we have a very wonderful mentor with us, like Dr. Maryam will guide you wholly about the process. Okay, so any question up till now? These are the feedbacks I will show you later. Any questions anyone want to ask?
Ma'am, how many times in a year do AMC conduct their exams?
Okay, it's only like January and December are the 2 months they will not conduct their exam. Except these 2 months, every month the exam will be taken. And it's like 6 days of exam, not the one. Starting from Monday till Saturday. Every month. And the beauty of this exam is that, like for example, I have booked my exam for September. but I feel like my preparation is not good. I can make it to change to November. I can make it to change to February. I can make it to April. Also, and not even the date, I can change my center as well. Like if I get my center in Bangkok, if I get the later seat in Myanmar, so I can change my center as well. But the timing slot, they will give their own. Like if I have get the time slot of 8 a.m. in the morning, if you change the center, maybe luckily you will get the 3 p.m. slot. Timing, they will give their own, but the date and center you can change. But after a certain period of time, you will not change because they will charge you something.
Thank you.
Yes, anyone, any question? For AMC clinical examination, it's a really tough one. It's really tough one. You need to give across like 12 months or maybe more or maybe less. It depends upon how you are competent you are with your clinical experiences, and also depend upon how course you are taking, and also the pathways you choose, either physical examination one like online exam or face to face, because both take different time period. No, basically, if you want to just book your exam, you require a permanent registration even from Pakistan. Okay, for the minimum time, you have to at least prepare for, I guess, 5 months, minimum 5 months, not hurry than that. Because 3 months you have to take the course and yes, sure.
Ma'am, can you tell me about the house job specialities, like the requirement they need, like 3-to-1 module system in hours?
Okay, the main thing is you have to, some people in Pakistan or India, like they have the more options. Like in our country, we have a subspecialties option after doing GS or GM, like general surgery, general medicine. We get the option to do 3 months of nephrology, to do 3 months of urology. But as far as I concerned with the system, my basic advice is please do your house job or internship in the basic subjects like in gynae, surgery, medicine, and peds. These are the basic subjects, and it will help you a lot, because your main exam of AMC will concern from these subjects, as well as when you apply in any job for RM or shift level 1, you have to experience in these subjects as well. And if you get the emergency rotation in your own country, that's the best one, which include ICU or CCUs. This is the best one. Yeah, it's like the both pathways. For example, after passing your AMC MCQ1 exam, you just get a job. You will get the limited registration. For this, you have to do pathway. Either you just switch to work-based assessment, that is also required for 12 months of job, or you will do AMC clinical exam. AMC clinical exam also require 1 to 2 minimum 1 year of practice, because it's not easy and the passing rate is very, very low. Any other question?
So that means, ma'am, within a year you need to do further enhancement in your qualification, or give another exam to continue.
Yes, if it is hard for you, like getting a job and you feel like it's very hard for you, so you can take a work-based assessment. Back in 2017 or 16, there's only less program that was providing work-based assessment. But now in Australia, more of the countries are providing work-based assessment program, so you can easily get it. But for this, you have to enter the system first.
Thank you.
Okay, so you are talking about both the exams that are very different from each other. Like MRCP is a degree basically, and AMC is a licensing exam. So AMC, as I told you, that it's easier for the one who just take the course, who just do the clinicals very good in every aspect, because everything will be count. But in MRCP, because it's for it's a degree program, specialized pathway, it is for more from the medicine. But in AMC, you have to do everything in detail. If anyone want to ask about the course charges, the regular courses or the other courses, you can contact Asma. Asma will give you very good offers according to this.
Hello? Hello?
Hi,
Yes,
Dr.
yes,
Suman, we can hear you.
Hello?
yes,
Ma'am,
doctor.
can you repeat the subjects? Which is more important in AMC test?
According to the weightage, as I told you guys, that medicine is the key. Like 30% from medicine, 20% from surgery, 12.5% for pediatric gynecology, 10% from psychiatry and public health.
Hello?
Doctor, can you hear me?
Yes,
Ma'am,
Dr.
can you
Nabira,
repeat
your
the
voice is
subjects?
clear. I guess there is some interruption in Dr. Suman's voice.
Oh, all right. About the course, Asma will guide you fully. They will give you even the best offer. The one thing I like about the Med Expert is they will bring for the bundle offer for their students. This is the very kind of them. They are bringing the very good bundle offers, even for the regular course one, even for the crash course one. Yes, doctor.
So, dear
Asma
all,
will
if you
be
want to,
tell about this.
yes, so we have bundle offers for all the students out there who wants to take two products from us. We're going to give you a lot of discount. We have mentioned our course counselor numbers. Just contact us there. We're going to make amazing packages for all of you, so all of you can afford. We do provide full payment options and installment options as well. So do contact us for more details. Thank you.
And ma'am, like, what is the salary per month for a doctor who joins in the AMC and gets a job, approx in
It's
US dollar,
it's
in
basically
US
it's
dollars?
basically depend upon the type of job you are getting. Like you are getting the level 1 job, level 2 job, or level 3. Level 1 is for the initial. It's like the basic senior house officer like job, like senior internship job. It's more like observational job, but they will pay you more or less likely after reduction of tax. It's like $7,000 to $8,000 per month. But if you do more shifts and you are doing Sundays and extra work, they will pay you obviously extra amount. But all depend upon the what type of level of job they are providing you, which area they are providing you, either it's rural or it's urban. It solely depend on the whole. Every hospital have different things.
And ma'am, a level 2 job, if somebody, suppose if they have an experience of 10 plus or 15 plus years in their own country and having some specialization also, and if they want to, if they get a level 2 job, approx salary will be how much in US dollars or Australian dollars?
Again, I'm depending that maybe you have 15 years of pretty experiences, but might not be possible they will provide you level 2 job. Maybe in some areas they have shortage of people, so they will give you a registrar job. That will be the high level job, so that your salary will be based on the registrar one. Maybe if you apply in the in main city like in Melbourne, and they have more people like you, so will they provide you a level 1 job. It's all depend on the hospital, which type of job they are providing, which position they are providing, and according to their salaries. But as far as
Okay,
I told you that after US, Australia is the highest paid country.
thank you, ma'am.
Hello? Hello?
Yes, doctor. Asma will give you all the guidelines. Keep updated. Also, Dr. Maryam will join us for the OET and how to just get that English test. So let's just welcome Dr. Maryam.
Ma'am, can you give us a clue of how much we are going to be paid?
Sorry, I didn't get your question.
You said job. You said salary depends upon the type of job you have. So just a clue of how much we are going to be paid here.
As I told you that for the level 1, and if they are giving you like any rural area, it's like $7,000 to $10,000 with reduction or plus minus with reduction. It's pretty couple salary as compared to other countries, as compared to other countries' exam. Like for other countries, you have to apply for the whole pathways for whole January part 1, part 2. But Australia is the only country who will provide you a great offer after just passing AMC 1. So I don't think so. It's a bad offer of getting $7,000 or $10,000 after just passing the part 1. Even if you do more like night shifts and you do more hard work, you will even get more money. It's very simple.
Okay, ma'am.
Yes, regarding IELTS and OET, Dr. Maryam will tell you wholly in detail. Remain online in this thing. Dr. Maryam will tell you every detail.
Hello, am I audible to all of you?
Yes, Dr. Maryam,
Yes,
you
Dr.
are
Maryam.
audible.
Okay, thank you so much, Dr. Nabira, for passing this webinar to me. And thank you so much for such an amazing information. So I'm really, really impressed. And again, the
Welcome.
congratulations on passing your AMC exam. So
Thank
thank you
you
so
so
much.
much, Dr. Maryam. You can continue.
You're welcome. Oh, thank you. Thank you so much. Let me share the screen. I think I'm co-host of the meeting as well. Is my screen visible to all of you?
Yes, Dr. Maryam, it's visible.
Okay, thank you so much. So I welcome you all in today's webinar. We know that Dr. Nabira has already mentioned about things about AMC exam and all. So I'm here to guide you all about OET exam, Occupational English Test. I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert, and currently I am working in Republic of Ireland in obstetric and gynecology. So let's start our today's webinar, and we have to start basically with the OET exam, because we know that day by day significance of OET is increasing. So definitely the first and the very basic question is, what is OET? So OET is Occupational English Test, and OET accurately reflects a candidate's ability to communicate in an English-speaking healthcare workplace. OET reports a scale score from 0 to 500 and a letter grade from A to E for each individual subtest. OET exam is accepted by healthcare professionals who are looking to work or study in healthcare sector in Australia, Canada, Ireland, Maldives, Malta, New Zealand, Philippines, Qatar, Singapore, Spain, Ukraine, United Kingdom, United Arab Emirates, and United States of America. So these are the countries these are the countries which will ask you for this exam. And to be very honest, I think in all the English language test, OET is comparatively easier than all. So I would advise, it would be my honest advice to anybody who is planning his or her career in abroad, I would advise them to take OET exam. So now let's talk about eligibility of OET exam. So OET exam is conducted by Cambridge Boxall Language Assessment, CBLA, Occupational English Test, which is being conducted by Australia. So basically it is an Australian exam. So OET is an exclusive English language test that has been designed for healthcare professionals. This exam has been specifically designed for 12 healthcare professionals, including occupational therapy, dentistry, nursing, radiography, veterinary sciences, medicine, speech pathology, physiotherapy, dietetics, podiatry, pharmacy, and optometry. So these 12 professions are those in which OET exam can be taken. So now the question arises, like, how much time span is required for preparation of this exam? So ideally 30 to 45 days, which are equivalent to 1.5 months, are usually required to prepare for the OET exam. And you need to practice at least 30 listening, 30 reading, 15 letters, and 10 speaking if your basic English is good. So this is an ideal estimate, and it definitely every person has his or her own caliber. So it varies from person to person. But ideally, if you are practicing this number of tests in each module, then definitely you're good to go. You can easily score grade B. If basic English is not good, then you should be having 60 days maximum for taking the exam. So ideally 1 to 2 months are more than enough for preparation of OET exam. If you think that like you have a maximum number of time span and the students think that they should be preparing for the OET for around 5 to 6 months, it is not the ideal situation. I would advise to all of them who are planning this much time span for OET exam, this is not the ideal scenario. 1 to 2 months are pretty much good time for preparation of this exam. So now another question is when to book. With increasing ratio of healthcare professionals applying for foreign jobs and study, ideal situation is to get your exam booked 2 to 3 months earlier before sitting in it, because situation these days is awful. And sometimes you may face difficulty to secure your desired city center and venue. Like you may face difficulty in securing your slot in your desired city. So it is recommended that you can book your exam 2 to 3 months before planning to take it. So now another FAQ is about exam cost. So exam cost you 587 Australian dollars, which is equivalent to 1,50,000, I guess. I'm not pretty sure about the conversion rate, but I think so it is this much amount. Exam is conducted 24 times a year and twice a month, and computer-based 11 times a month. So this is another frequently asked question by a lot of aspirants, like how many times exam is conducted in whole year. So this is the most important thing which I'm going to discuss now about the validity of OET exam. So how to manage time while stepping in career abroad. So please, all of you listen very carefully. So this is the very important thing to listen. OET exam is valid for 2 years only. So you can say about like expiry date or the validity date. So your exam is only valid for 2 years. So if you are planning your life abroad, it must be necessary to plan things accordingly. Whatever necessary documentation and verification you can done in the meantime can save you in wasting time, as these are very time-taking process, unfortunately. Must things to do is to check for the regulations of the council or the country to which you are applying. This is the very basic thing, because a lot of aspirants are not having the very basic knowledge about that country in which they are applying, and in that scenario their validity will expire. Always read proper guidelines and then start your workup, because if you are not well aware of terms and regulation, then it will result into expiry of your exam definitely, and waste of your time and money as well. If you are planning to appear in AMC soon, you can take OET right now, and then a lot of job opportunities will open up for you in Australia, because we know that Dr. Nabira told us that you will be having a good number of experience and you are planning to take AMC, then definitely if you are also planning to take OET, then you are in a good position to go for a job in Australia. So now the good thing MedExam Expert is offering is our silver plan, which includes our OET regular course. And the features of OET regular course is you will be having 16 live practice sessions of all 4 modules, which are listening, reading, writing, and speaking. So you will be having 16 live sessions And then you will be having practice exercises of all the 4 modules and 7 live letter assessments, speaking practice with individualized feedback. So the duration of our course is 1 month, and you will be having access till your exam, because you will be a part of a study room till your exam. So group assignments, study room guidance, session recordings, mock exams, and 24/7 technical support, all these are the features of our OET regular course. So now there are assessment packages as well, which Med Exam Expert is offering. We have made different plans: Plan A, Plan B, and Plan C. So for Plan A, if you think that you fall in this category, you will be having 10 letters, 10 reading mocks, 10 listening mocks, 5 speaking mocks, and free recorded lectures of all 4 modules. And if you think that you have to follow Plan B, then definitely it includes 5 letters, 5 reading mocks, 5 listening mocks, 2 speaking mocks, and free recorded lectures for all the 4 modules. And then there is Plan C. It is for those students who have prepared well for the OET and who thinks that, like, who just want to get evaluated themselves. So this plan is for those. So it includes 3 letters, 3 reading mocks, 3 listening mocks, and 1 speaking mock, and free recorded lectures of all the 4 modules. So these are our assessment packages. And definitely, MedExam is also offering OET mock exam for all the 4 modules. And we will also be following the same pattern according to the real exam. That listening would be of 40 minutes, reading will be of 60 minutes, and writing, you will be given case notes, and then you have to write a letter in complete 45 minutes. And then speaking, it will exactly according to the exam pattern, that you will be having a interlocutor, like one of the mentor from the OET math exam will be your interlocutor, and you have to perform a role play in front of the mentor, and you will be evaluated according to your performance. So these are the features of our mock exam. It's totally up to you. Whatever, like, if you think that you are the candidate for mock exam, you can talk to our coordination team. But if you think that, like, you are not well prepared for OET exam and you need a whole course, then definitely you can talk to our coordination in this regard as well. So now there is an announcement that our next live course is going to be started on 14th of June. And the duration of the course would be of 1 month. I will be your writing mentor. If I meet you guys in the course, then definitely I will be your writing mentor. There's Dr. Ifat, who will be covering reading and listening, and Dr. Javeria will be covering speaking module. So 16 live practice session will be there, and you will be provided with the course content, practice exercising, live letter assessment. Because I'm a writing mentor, I can honestly tell you about the writing module, that after covering the session, we are having live letter assessment. Everybody has to submit their assignments, and in the class, everybody will be evaluated in front of everyone. And this is a very healthy practice for learning mistakes and all the things. So study room guidance, and you will also be given the session recordings, because it is not possible for everyone to attend the session at the specified time. So definitely students
Hi, Dr. Maryam, can you please check your mic?
Hello, am I audible now?
Yes, Dr. Maryam, you're audible now.
I'm sorry, I don't know what happened to my screen and all. So I'm not even sure like on which slide we were.
Like we were in the last slide of questions. We can ask questions from the participants now.
Oh, okay. That's good. So if anybody of you have any question, you can ask me.
Thank you so much, Dr. Maryam, for all the insights for OET. You did a great job and everything. I guess all the students out there who were, curious about OET, they know about it now. And if anybody has any questions regarding OET or AMC, we are here for your guidance. Just write in the chat box and we are going to answer all the queries. Hi, Dr. Aaron. You can go for any English test like PTE, IELTS, or OET, but we too prefer, OET. Why? Because it is specifically designed for the doctors out there. So we do prefer OET.
Thank you so much, Dr. Mariam. You will give a great session. It's very helpful for me as well because I feel like my PT will expire next time, so I'll get surely OET from you.
Thank you so much, Dr. Nabira. And
It's
you
an
are always
amazing
very
session,
welcome.
and I'm surely will get from you. It's an amazing. Thank you so much. Okay, so
Thank you so
two
much,
people
Dr.
are
Nabira.
asking me the same question, so I need to answer it again. First, you have to enter the system, right? After giving AMC MCQ exam, if you get the job, you have to do work like 1 year or 2 year as an HMO, JMO, or RMO. Meanwhile, you have to decide it whether you have to give a clinical exam or you will have to choose work-based assessment because it is limited registration for after getting part 1 and in the job, right? So after giving that exam, within meanwhile, 1 to 2 year of RMO, JMO, HMO, whatever the type of job you will get. After that, you have to go in residency program as well. Like if you are posted or rotated in emergency and you show interest, they will ask you for the interviews. They will back-to-back interviews for that. And if you want to enroll in any university like Monash or any medicine university, you will get the residency program whatever the field you want. Surgery is always challenging in every country, but if they will post you for the rotations, for example, they will post you for ER. In ER, you have to take care of every department like surgery, gynecology, peds, and every. And if you are competitive enough or you are good enough, you can go for that department for 6 months or 3 months and then ask the supervisor to post on that. It's all about the context. It's all about doing the hard work for that field. And it's all about how you are dedicated to that field. You can easily get the residency program, but not like USMLE that you will clear the exam and get the residency. You have to do JMO, HMO levels. Then you will get the residency.
Actually, there is a query in the comment box. Clubbing of OET scores are accepted in Australia. So for all the candidates of the OET medicine, clubbing is not allowed in any country. So keep this thing in mind. You have to pass the whole OET exam in one sitting.
No, it's not like the pay or paid exam for the residency. It's like basis on the interviews. It's basically like a simple job. They will like you have done with the AMC exam, MCQs and clinical both. After that, everything will depend on the interviews. If you want to switch the hospital as JMO level, they will interview. If you want to get in the residency program, it will interviews. It's all depend on the interview levels, not about the pay. It's all about the levels of get you or getting like HMO level residency program all depend on the interviews. No exam after that. After clearing 1 and 2, you have to go for the interviews. I hope it's clear to you, Dr. Arun. It's perfectly fine if you didn't even done your rotation in gynae and peds. I myself didn't done my rotation in these two major subjects, but I will pass AMC exam just because of getting that academy touch, because academy will polish you wholly. They will provide you every material. But for as far as for the job point of view, my opinion is to get in these two field in your country if you get a chance, like in peds and gynecology. And if you get done with house job, you can take 3 months of rotation or attachment, whatever it's called in your country, in your home country, for the sake of job. But for AMC exam, they will provide you the courses and everything. PT is acceptable for doctors, but as Dr. Maryam said, you guys, that OAT will be more preferably important and easy as well as compared to PT, because OAT having lots of things from related to medical things. So I'll go for the Dr. Maryam because my PT will also expire. So I'll go for the OAT with Dr. Maryam. Regarding visa, if you after doing AMC1, if you apply for the job, the whatever the hospital who will provide you the job will give you the visa as well. Either it is for a contract basis for 1 year, 2 year, it depends on the hospital policies. Or if you just want to go for the visit visas, for visit visa have different conditions. Like you cannot work, but you can observe or see. But for this, you have to mention in your applying visa for visit visa that you are going for observership if you want to. So every visa have different things. But what I know is about on visit visa, you cannot work in any hospital unless and until hospital will allow you and give you their own visas and will help you to migrate from your own country to the other country.
I guess that was all for today's webinar. I guess all the questions have been cleared now, but if you have still any question regarding AMC or OET, we have mentioned or course counselor numbers, you can contact us anytime. And we have amazing offers for all the students who want to join AMC and OET programs from MedExam Expert. We have amazing offers for all of you. So that was all for today's session. Thank you, Dr. Nabira and Dr. Maryam, for joining us for today's webinar.
Thank you so much, Asma. Good luck to everyone.
Thank you so much.
Hope wish you see in the crash courses or regular courses. Goodbye.